Everything you need to know about high blood pressure. You may be more likely to have high blood pressure due to your genetics, age, and whether you have certain health conditions. Treatment may include medication. Your blood pressure measurement takes into account how much blood is passing through your blood vessels and the amount of resistance the blood meets while the heart is pumping. High blood pressure, or hypertension, occurs when the force of blood pushing through your vessels is consistently too high. In this article, we'll cover the basics of hypertension, including its symptoms, causes, how it's treated, and more. What is high blood pressure? Narrow blood vessels, also known as arteries, create more resistance for blood flow. The narrower your arteries are, the more resistance there is, and the higher your blood pressure will be. Over the long term, the increased pressure can cause health issues, including heart disease. Hypertension is quite common. In fact, since the guidelines changed in 2017, nearly half of American adults could now be diagnosed with this condition. Hypertension typically develops over the course of several years. Usually, you don't notice any symptoms. But even without symptoms, high blood pressure can cause damage to your blood vessels and organs, especially the brain, heart, eyes, and kidneys. Early detection is important. Regular blood pressure readings can help you and your doctor notice any changes. If your blood pressure is elevated, your doctor may have you check your blood pressure over a few weeks to see if the number stays elevated or falls back to normal levels. Treatment for hypertension includes both prescription medication and healthy lifestyle changes. If the condition isn't treated, it could lead to health issues, including heart attack and stroke. 5 categories define blood pressure readings for adults. Healthy. A healthy blood pressure reading is less than 120/80 mm of mercury, mmHg. Elevated. The systolic number is between 120 and 129 mm of mercury, and the diastolic number is less than 80 mm of mercury. Doctors usually don't treat elevated blood pressure with medication. Instead, your doctor may encourage lifestyle changes to help lower your numbers. Stage 1 hypertension. The systolic number is between 130 and 139 mm of mercury, or the diastolic number is between 80 and 89 mm of mercury. Stage 2 hypertension. The systolic number is 140 mm of mercury or higher, or the diastolic number is 90 mm of mercury or higher. Hypertensive crisis. The systolic number is over 180 mm of mercury, or the diastolic number is over 120 mm of mercury. Blood pressure in this range requires urgent medical attention. If any symptoms like chest pain, headache, shortness of breath, or visual changes occur when blood pressure is this high, medical care in the emergency room is needed. A blood pressure reading is taken with a pressure cuff. For an accurate reading, it's important you have a cuff that fits. An ill-fitting cuff may deliver inaccurate readings. Blood pressure readings are different for children and teenagers. Ask your child's doctor for the healthy ranges for your child if you're asked to monitor their blood pressure. What are the symptoms of hypertension? Hypertension is generally a silent condition. Many people won't experience any symptoms. It may take years or even decades for the condition to reach levels severe enough that symptoms become obvious. Even then, these symptoms may be attributed to other issues. Symptoms of severe hypertension can include flushing, blood spots in the eyes, subconjunctival hemorrhage, dizziness. According to the American Heart Association, contrary to popular thought, severe hypertension doesn't typically cause nosebleeds or headaches, except when someone is in hypertensive crisis. The best way to know if you have hypertension is to get regular blood pressure readings. Most doctors' offices take a blood pressure reading at every appointment. If you only have a yearly physical, talk with your doctor about your risks for hypertension and other readings you may need to help you watch your blood pressure. For example, If you have a family history of heart disease or have risk factors for developing the condition, your doctor may recommend that you have your blood pressure checked twice a year. This helps you and your doctor stay on top of any possible issues before they become problematic. That is it for today. Watch out for more info in my subsequent video. Subscribe for more content as well.